You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, natural looking facelifts. With us, we have an expert on the topic. He is Arkansas's go-to facial plastic surgeon when you want a natural looking result. With us, we have Dr. Jared Spencer. Dr. Spencer, welcome to the program.
Thank you. It's great to be here. Thanks,
All right.
Randy.
Now, starting off, you brought a lot of photos, and people need to know that I'm not siding with you, but these are really, really good photos.
Right.
So I hope they can stick around for these.
Sure.
But for people that don't know you, who's the typical patient that's coming in for facial rejuvenation, facelifting, mini lifts, things like that?
Well, I generally have two categories of patients that come to see me in my office. The first set of patients are bothered by a particular feature of the face. Whether it's a bump on their nose, whether it's their chin feeling like it's too far back, maybe prominent ears, something that has just bothered them, and they can be younger patients as well as older patients. So that's the first category. The second category that can affect everybody are those that are bothered by the effects of age and what it's doing to their face and their skin and their neck. The second category of patients that I'll generally see are those that are bothered by the effects of age and what that's doing to their skin, their face, and their neck. And so these are patients who are starting to notice jowls, laxity under their chin, hooding around their eyes, and crow's lines. And the same patients that may not be thinking about it, but they may take a selfie, for example, and look at the selfie and think, where did that come from? Is that really me? I gotta change my angle on that. And then they do a different angle, and they start noticing things from the first time.
Do they come in knowing what they want now? Like where they say, I hate this, I hate this, I hate this? On like a consult with you?
The younger patients generally do. And that's maybe a generational thing. Sometimes the older patients will come in and tell me, just tell me what I need and what you think would look best. The younger patients that see me, maybe it's because of the selfies they're taking and, everything that's going on with social media, but they know, they have some crow's lines they want treated, or they, don't like the way their eyes are looking a little tired, or they're bothered by their neck, and they just want to look refreshed. Honestly, they don't want to look like different people. They just want to look refreshed. And most people that come to see me really are active, healthy, and really just normal people. They don't want to look different. They don't want to look like...
Do they say that? Like, I don't want to look done?
Yes.
We use that here in California. Like, nobody wants to look done.
Yes, absolutely. In fact, where I practice, people come to see me and say, now, I don't want to look like, the people that I see on TV, in Hollywood, and things like that, because they can tell they've had a facelift. And the people that see me, they want to look like themselves. They just want to, look their best.
Look a little younger.
Yeah, exactly.
How many years can you get? I'll put you on the spot here. 5, 10 years younger? With like a mini lift, some of these lifts we're talking about?
Yeah, I'll generally tell patients, depending on at the point they're at in the aging process, probably about 10 to 15 years sometimes. And
really? Okay.
Sometimes less if somebody's coming in a little sooner, and sometimes even more, depending on the result that we can get.
And we should mention, you're double board certified, right? In facial plastic surgery.
That's
and
right.
also otolaryngology or ENT.
That's right, yes.
And you used to work, I guess, at the world famous that lifestyle lift centers.
Yes.
So you've done a lot of facelifts.
Yes, I've done facelifts throughout my entire training.
So this is all you do? I mean, all you do is face?
That's
Nothing
right.
else?
I focus exclusively on the face. That's right. So this is a patient who came to see me in her 50s, and that's actually a very common time for patients to come to see me. I generally see patients kind of at the start of their careers, some at the middle of their career, and some at the tail end of the career. In fact, some people see me as a retirement gift that they're giving themselves.
All right.
But probably the most common time frame for people to come to see me is when she did, her mid-50s, still feels like she still has a lot to offer. She herself is very energetic, professional. And so we talked about her jawline and the neck. And so now we can see her after pictures. And you can see, yeah, she has really a great jawline, beautiful neck, and she had it there the whole time. And honestly, she told me she probably hadn't seen that neck since she was in her 20s, and it was 20, 30 years later. And so she was thrilled, and I thought she got a great result. And this is something that looks dramatic and yet natural at the same time. And I have a lot of patients that will come to see me, and they'll say, I don't want it to look too tight. I don't want people to really notice, but at the same time, they want to look good. And so even though it looks great, it still looks natural.
Totally refreshed.
That's right.
And on the front shot, yeah, just looks younger. I mean, that's a good 10 years.
Yeah.
Looks like it could be this young sister or daughter, possibly.
The interesting thing with when she came in to see me after surgery is I didn't tell her what to wear or what to do when she came in for after pictures, but she obviously had her hair changed, she had makeup on, she had her lipstick on, and you could tell she just felt great about herself, and in fact kind of changed her hair, and I just loved to see it. She felt good and was really happy.
Now they do this in your office. A lot of these people are doing this under just IV sedation.
That's right.
Is that right?
That's right. Yes, that's my preferred way of doing things. There's really three options for patients to do things. One is under a general anesthetic in the operating room, which can be very costly, and that comes with some side effects and the downsides of a general anesthesia. The other is to do things under local, where there's no anesthesia except for numbing medicine. In my office, I've worked hard to come up with a middle solution where we can still do things in the office very safely, but comfortably under IV sedation. And so we have the benefit of decreased cost, decrease side effects from a general anesthetic, and at the same time, it's very well tolerated. I can do a good job, I can take my time, and I know my patients are comfortable, and we can get great results that will last a very long time. So this is another patient that came to see me in her mid-50s, and like so many patients come to see me, sometimes it's actually the grandkids that bring them in. And I think that might have been the case for her. They'll say their grandkids will start pulling on their neck or pulling on the jowls. And and that can be fun for a time, but some people in their, most people in the mid-50s, they don't want to look like a grandmother or a grandfather. They're just not ready for that yet.
So what did you do for her?
So she had some laxity to the jawline and to the neck, and so same thing, did a mini face neck lift, addressed the lower face and upper neck, and refreshed her appearance. Another point I want to look at is look at her cheeks on the after picture. They look fuller, they look fresher. She has more of a heart-shaped appearance. It's more youthful. And that's where the fullness went that was on her jawline, and that's where it had fallen to. And so I try to take the natural fullness that patients already have that's falling and bring it back up where it used to be to create a natural fullness to the cheek. And that can create a more youthful result without having to do fillers, fat injections, and a lot of other procedures that are popular as well, but can be done as well that way. So this is the 3/4 view.
Okay.
And this in particular really highlights her new jawline.
Yeah.
It looks great, and it also highlights her cheeks. So the upper part of her face, it looks fuller, more youthful, and honestly, that's the way her cheeks used to look. She doesn't look like a different person.
And that's considered a mini facelift, what we're looking at right here.
That's right.
What's the downtime on one of these mini facelifts, if everything works out right?
So generally 7 days. At that point, they can get back to work and get back to what they're regularly doing.
So that's not long.
No. Sometimes I'll have them wait 2 weeks for strenuous exercise, but most patients have to get back to work and get back to their lives, and so we try to have them get ready to go after about a week. This is the before picture, and I really want you to look at the neck. You can see the lines, the laxity there, and then also look at the jawline and the cheeks, and then look at the afters. Everything is refreshed and it's smooth. And she was thrilled. I thought she had a great result.
When they see it, like when it's all healed up and they're looking in the mirror, do they ever get emotional?
Oh, they just love it. Yeah, at the point we take these pictures, this is about a month out, and so they've already moved on. They've already, they've adopted their look, and for them, when I show them the before pictures, that's really what's stunning to them is I can't believe that's what I look like, because they all of a sudden feel like this is me, this is how I always felt like I was. This is how I looked, years ago, and they're moving on with their lives.
Who should get this done?
Really, anybody who's bothered enough by it to get something done. And I have patients come to see me, sometimes younger patients, and they'll ask me, do I really need to have this done? And then I'll put it back on them. And I'll ask them, how bothered are you by it? And if it's something that you're bothered by, that you think about, that you feel like, you want to kind of look refreshed, look younger, then it's worthwhile doing. And patients at any age can do that. So this is another patient And this was also a mini lift. And Randy, I want you to look at her jawline again. You know, everything just looks refreshed and put back up kind of where it used to be.
Very nice.
Still looks natural, but just refreshed.
And you call it just a face neck lift or a face mini lift?
That's right. You know, I have 3 varieties of lifts. You know, a mini lift, a young woman's face neck lift, and then a full face neck lift. And they're all variations of the same thing, but I do whatever I think will look optimal for the patients, but still natural. And so this is another patient. She was actually just starting a new career and actually going back to school and was finishing up with school and, you know, was finished with one phase of her life and was starting another. And so just wanted to look refreshed and kind of move on. And I thought she did great, you know. This is, again, a mini lift done in the office. This one was done under local anesthesia. And if you can look at her jawline and her neck, I think it looks great.
It's very nice.
I also did her eyes, and that obviously adds to it. You know, for patients that come to see me, most patients at some point in their lives are going to be candidates to do their upper lids, their lower lids, and the face and neck. And some patients will also benefit from a brow lift, but not everybody. In fact, if you do a brow lift on everybody, it will make them look unnatural and surprised. And that's one thing that everybody tells me when they come in. They don't want to look surprised. And an eyelid procedure will never do that. You know, it's
so that's what, just the skin over the eye? That's what you did for her?
Yes.
So when I look at the before and the after here, you just took like a little bit of skin right there.
Right, that's removing the excess skin to the upper lid. And some people have a little fatty fullness as well to the lower lids. But if you do that, that will never give a surprised look. Now, if somebody has a depressed brow, you know, we could do a brow lift and that'll help out and make them look refreshed, but not for everybody.
Okay.
But most people, you know, would likely benefit from an upper lid blepharoplasty or an eyelid lift and a face neck lift at some point. So this is another patient, and I just want to focus on her eyes. This patient came to see me probably for one of the most common complaints that I see. She felt like she just looked tired, and people would ask her, you know, you look tired. Are you okay? Are you sleeping okay? You know, she actually said she felt fine. She felt great. She's still working.
So like people at work say, "Are you tired?"
Right.
Like, does everybody know you're not supposed to say that?
I know.
And they still say it.
They still do. Yeah.
Okay.
And so. And she had enough. And so thankfully, you know, there's procedures that can be done, you know, minimally invasive.
So what'd you do for her?
And safe. And so I did her eyes. So we did an upper lid blepharoplasty or an eyelid lift.
Very nice.
Also a lower lid blepharoplasty to smooth out the appearance of the lower lids. And then also touched up the face and the neck. So I want you to look at her eyes now and look at how alert she looks, you know, in the after compared to before.
Yeah.
You know, that's the way she always felt. And she was just thrilled, you know, with the way that looked, you know, and also the jawline. And she was also bothered by her neck, you know, and a lot of people will develop laxity or looseness and even muscle bands.
Yeah, so she had that right there.
She did, and some people aren't sure if anything could even be done with that because part of it is a muscle band and part of it is lax skin. But it can be refreshed very naturally and look great, just like for her.
So a woman like this, let's say you take a 60-year-old, you make them look around 55 or 50.
Uh-huh.
If you take them 10 years out, 15 years out, are they going to continue looking a little bit younger than people their same age?
Yeah, absolutely. You know, people do ask me, how long does the result last, or is there a permanent result? And I tell patients there really is permanency or a permanent result because there's permanent tightening that's done, there's actually skin that's removed, and 10, 15 years down the road, they will still look. If we took them back 10, 15 years, they'll still look 10 to 15 years better. Unfortunately, they won't look like they looked right after surgery, but they'll never lose that benefit that they gained from the surgery. And with some patients, if we do a mini lift, for example, in the late 40s and 50s, you know, we'll do a touch-up lift down the road, maybe 15, you know, years later, and it's much easier to do a touch-up lift than if somebody waits the entire time. And I want to show you a picture of that in particular. This was a patient that actually did. She had a facelift about 15 years before. So what do you see?
Yeah.
You know?
Well, she looks at least 10 years younger. Mm-hmm. It's also, because we had a discussion in the green room, that it adds to their attractiveness. Mm-hmm. I mean, she's prettier.
Right.
I don't want to sound superficial, but she's prettier in the after.
Yeah.
Do women say that? I mean, do they want to look different? Do they want to look younger? Do they want to look pretty, or all of the above?
Yeah, they usually say they don't want to look different because they don't want to look like a different person. They want to look like themselves, just refreshed or taken back a few years.
Okay.
And you know, when I see those two pictures, if you look at the before, I see somebody at the grandma stage of her life, you know, and she honestly was not ready to be there. Most people aren't, you know. They may be excited to be a grandma, but they're not ready for, you know, the grandma stage, you know. They don't necessarily want to look like the grandma, you know, and it's not necessary.
And so a downtime on something like this is what?
It's about a week, you know, before we get them back out there again. This is a patient that actually came to see me in her 40s. And so what we did for this patient was a mini face neck lift.
It's subtle, but it's very cleaned up. That neck looks good.
Yeah. And so this is 1 month out from her procedure. And I want to show you that, Randy, because this is actually her 1 week after surgery. And a lot of patients will ask me, well, what am I going to look like, you know, a week later? And this is really it. And so
I mean, you can't even see the scars.
Right.
Where do you hide them?
This is with no makeup on, and so she may have a little bruising that kind of goes down to the low neck, but depending on what somebody wears, they could really head back to work, you know, even with that. Okay, so here's another patient that comes in bothered by the jowling, feels like she looks tired, bothered by her neck. And so I recommended that she do a face neck lift. Actually, it was what I call a young woman's face neck lift, but I also recommended one other thing, a chin implant. And I want you to look at the profile shot. Now,
okay.
So the first picture, now what she saw was, you know, no jawline, laxity to her neck. What I saw but she also had a weak chin. And even if I did a face and a lift, without giving her a chin implant, it wouldn't give her the result that she was hoping for. And so I did a chin implant,
wow,
a young woman's face neck lift, and you can see the result in the second picture. It looks great.
She looks fresh, no doubt about it.
And I want to show you another patient.
All right.
And I just did her eyes, so her upper lids and her lower lids. And like a lot of people, she was feeling like she just looked tired, and she did, you know, and so I did her upper lids and lower lids, and you could tell the difference. She just looks refreshed, she looks younger, she looks prettier, and she was thrilled. Do I have time to show a few rhinoplasty pictures?
Sure, a couple more.
Okay, so.
Good photos, by the way.
Oh, thank you. This is another kind of category of patients that I see a lot of. Younger patients, you know, could be patients of all ages, really bothered by some features of the nose. And this patient in particular felt like her nose was drooping down too much, and it had bothered her for years. And so simply shorten the nose, smooth the profile, and it made a dramatic difference. It still looks great, still looks natural, but I think it's a great result. Yeah,
looks very natural.
Yeah, what's important in a rhinoplasty is that the nose still maintains its stability and its breathing ability.
Now this is your space, right? I mean, you're ENT,
yes,
board certified, and
That's
also
right.
facial plastic.
That's right.
So you do a lot of noses. Like every week you do a nose?
Right.
A couple times a week?
Every week I do at least 1 or 2 noses. And then
because a lot of guys don't like noses. Isn't that true?
Right.
They say you got to get them right the first time or something?
It's right. It's considered the most difficult, actually, plastic surgical procedure. And I would agree. I think if you do noses, you really have to pay attention to the function as much as the form and the way it looks. And so here's another patient, actually a younger patient, that was also bothered by her neck. She just didn't feel like she ever had a jawline. And I recommended some submental liposuction, which would help with that. But I also recommended a chin implant, something that would look very natural but help out with the jawline. And the after result, I think, looks great. You know, much more defined.
You can't really see a chin implant.
No,
if it's done right. I mean, it's just so subtle here.
It contours to the natural contours of the chin. It has the same shape, it's just projected more. In this patient, 20 years down the road will look younger than she would have looked if she didn't have this done, because it maintains the look of the jawline even throughout her life.
Okay, good.
I have another story of a patient. She actually came to see me. She was like her, but not bothered by the chin. She was bothered by her nose. She always felt like her nose was too prominent, too big, and too projected. And she came in and had her boyfriend with her, and we all noticed in the office that her boyfriend honestly wasn't that nice or respectful to her. But we saw her, and her nose looked fine. Her nose looked good, but her chin was too far back. And what I recommended for her was a chin implant to help balance out the face. And that's what we did. And it looked great. And once we did that, her nose looked fine. And that's sometimes all patients need. And with her, it was interesting when she came in for her follow-up, she didn't have her boyfriend with her. So he was long gone. And I don't think it was the...
So all of this is like a boost to their self-esteem, self-confidence.
Right. I don't think
right?
it would have taken surgery for her to get rid of, her boyfriend, but she would have probably come to that on her own. But nonetheless, she did have more confidence. She felt better about herself, and that was good to see. And this is another a male patient, and he came in with his parents, and he had always been bothered by his chin. And
it's just a weak chin, you call it.
Yes, and so a weak chin. In general, with males, we like to see the chin close to the level of the lower lip, and if it's too far back, it generally is considered a weaker jawline. The nose can look more prominent, and it can lead to early signs of aging, on the neck as well. So recommended a chin implant, and I think for him, he was a great-looking kid before,
wow.
and great-looking after, but more balanced and a stronger jawline. I think it looks great.
Now today we're talking about the natural-looking facelift. So the downtime could be like 7 days.
That's
Do some
right.
people go back to work earlier? Like they're stubborn, you say, hey, take a week off, but they go back to work 4 days later? Does that ever happen?
Honestly, patients generally feel up for it, but I have them wear a dressing, and so I try to keep them back a little bit with the dressing, but the procedure is not a real painful procedure. They generally feel pretty good, and so the key is really kind of keeping them not doing too much, in that first week.
So that way they heal properly.
Yeah, I want them to heal as well as possible.
Okay, good. And do people do this for occasions like they're getting married, their daughter's getting married, they're broke up, or they're single again or something? Is it occasion kind of a thing? They're going to a reunion.
Yes, absolutely. In fact, I see patients, for various things at different stages of their lives. I see a lot of young women that are engaged for their ears. And I had one particular woman that came to see me, and she was beautiful, but she came in with her hair down, and she said, I have never worn my hair up, and I would love to, but I'm just embarrassed about my ears. And she showed me her ears, and she had the prominent, what we call cup ear deformity, and explained that a very simple procedure could be done to improve the appearance of her ears without cutting any cartilage. In fact, the procedure involves just recreating the fold that patients lack, when their ear comes too far forward. And she was looking forward to having this done before her wedding date. And so did the procedure. I think it turned out great. And she came in for after pictures, and she already had her wedding pictures printed out.
Good.
And she was showing me with her hair beautifully done up, like she always dreamed of doing, and it felt great. And so I see a lot of patients around that time, of their lives. I had one guy that came in to see me, and he was actually 80 years old. And most men that come to see me are younger than that, but he was extremely bothered by the laxity to his neck. In fact, he called it his turkey waddle, and he said it always bothered him. He came in with his wife, and his wife said, yes, he's been complaining of this turkey waddle for 40 years, and I finally convinced him, and he to come in and see if something could be done. And he said, no, I really would love to have something done. I just didn't know if anything was possible. I know I'm 80. And I thought about it, and I said, you're otherwise a good-looking guy, still active, and he's still healthy. And I said, we can do this in the office, a small procedure, to eliminate basically your turkey waddle. It's not a facelift, but I call it a submental procedure, where I remove that excess tissue just locally right there, and I hide the incisions really well in the neck. And
so you can pretty much clean up any neck.
I can.
No matter how
yes.
far gone it is.
Right.
Interesting.
Yes. It's easier to do, I'll say, if somebody starts sooner.
So I interrupted you, that guy. So when it's all done, what does he say?
And so he was thrilled. So the procedure took about an hour and a half. He did great, and he came in and he just said, I should have done this long ago, but he really felt
40 years of complaining.
Yeah, but there really was a burden lifted, and he felt like, definitely worthwhile for me. I no longer have to think about that, and
Good.
and I love it.
All right, now final message. We're out of time. Somebody watching
Okay.
this, let's say a woman over 40, 50, 60,
Yeah.
70, 80, that just doesn't like the way she's aging, right? Like all the stuff you've showed, jowls, neck, things like that. But she's afraid for whatever reason, doesn't want to look odd or done or pulled. What do you say?
Yeah, I would say
person?
Just come into the office and let's talk about what can be done. I would say the motto of my practice as it's evolved is look how you feel and love how you look, really at any age.
Good.
You know, and most patients, you know, they feel good inside. They're not trying to change how they feel about themselves by doing something. They already feel good. They're active. They just want that represented in their appearance, you know, when they look in the mirror, when other people see them. And we can do that. You know, I have the techniques that are safe, very good modern techniques that can be done very effectively.
You say for some patients, this really changes their lives.
Absolutely, because they either look extremely tired when they're not, or some patients will look angry, and that's really not who they are. In fact, I have one patient that was a supervisor at her work, and she said all of her coworkers would come up to her and say, you know what? I used to be afraid of you because I thought you were so mean, and once I got to know you, I realized you're actually a nice person. But she felt like she carried on this kind of mean persona at work. And
Like she had a mad face.
Yeah, well, she came to see me, and sure enough, she had a downturn to the corner of her mouth. She had hooding over her eyes, and she had kind of the bulldog appearance of the face, you know. And she said, you know, I don't feel this way. I don't, you know, I'm a really nice person, and I'm tired of that, you know. And so I did a young woman's face neck lift, refreshed the jawline, brought up the corner of her mouth, refreshed the eyes. And she felt great, and she went back to work, and her coworkers, you know, honestly, her coworkers just say, "Wow, you look great. You must have taken a great vacation, you know, or
good,
man, you need to take a vacation, you know, more often because you know, look like almost a different person." And she was like, "I'm the same person, you know."
Now everybody goes up to her and says, "Why are you in such a good mood today?"
Yeah, right.
And she's saying, "No, I'm not in a good mood at all. I just saw a doctor." You know, we really are out of time. But final message: somebody watching this, they don't like the way they're aging. Their jowls, as you mentioned, their neck, the skin over their eyes, they feel like they look old. But for whatever reason, they just say, look, I don't want to get surgery. Maybe they're worried about getting done or looking odd. What do you say to them? The fearful patient.
Yeah, I would just invite them into the office. I'm happy to talk to them because I want no more than to make things look natural. In fact, if it doesn't look natural, it's not worth it. And I think once I talk about the procedure and how it's done, and honestly how minimally invasive it can be, and where the incisions can be placed and completely hidden, they're very surprised and thrilled with the results.
Okay, good. I want to thank you for coming on the show.
Thank you very much, Randy. It was great to be here.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.